isn't done to stop it spreading. That's the warning from researchers trying to find a treatment for the bacteria. Thousands die every year after picking up infections in hospital. Tonight, we've got a special report on the superbug. In a moment, Susanna Streeter on a possible method to combat it. But first, James Dagwell on just how bad the situation is.
MRSA, the invisible killer in our hospitals. It's a common bacteria. MRSA lives on our skin and normally does very little harm, but in people with weakened immune systems, it can be fatal. Just last month, a group of scientists said deaths from the superbug could double in the next 5 years.
There are much larger numbers of patients with bacteremia from MRSA than there were 10, 15 years ago, and that is a cause for concern.
In the UK, there are more than 7,000 reported cases of MRSA a year. That's up from just 1,000 in 1996. Research has shown that it's not a particularly difficult bug to kill, but unlike other bacteria, it has an extra gene which helps it fight most antibiotics, and it quickly becomes resistant. So why haven't hospitals got control of it, and what can be done to stop the bacteria spreading? MRSA can spread rapidly where a patient is in a ward with others. Some health experts think patients should be put in a separate room.
One of the things that is quite useful in trying to control transmission is having single rooms available, particularly for cases that we're extremely concerned about transmission. But the other issue you raise is actually very important. The lower the nursing staff ratios are, the more we are at risk of transmitting MRSA and other organisms around in the hospital.
And that means medical staff may not have the time to wash their hands between patients, potentially passing the bacteria on. Some scientists say the government isn't doing enough to find ways of killing off MRSA and other hospital-borne infections, although there are new hand washes available.
The old alcohol gels used to damage the hands, which actually could increase hospital-acquired infection transmission. The new ones, it's been shown if you use them regularly, improve the health of the hands. They're an extremely new way of trying to address this issue.
Many hospitals are still trying to find ways to kill MRSA for longer and keep it off the wards. The emphasis still appears to be on hand washing and isolation, but the bug isn't just spread by skin contact. It's also found in carpets, in curtains, and even on the ties of doctors. Well, Susanna Streeter is in Bristol now, where they're developing a new technology which they hope could be used to disinfect entire wards.
Yes, James, scientists here at the University of the West of England in Bristol have been working with what they believe may be a revolutionary disinfectant. It's a special kind of water which has been treated with an electric current, and first results show that it does kill MRSA and other resistant bacteria.
It doesn't really differentiate between an E. coli bug or an MRSA bug or any kind of bug, because really it's not looking at the biology of these bugs, it's really looking at the chemistry. In reacting with those bugs, it kills them.
By fogging this into a room, it seems to be relatively safe compared to things like bleach, in that it breaks down quite quickly. So after killing the bacteria, it should break down quickly and mean that patients can go back into a ward very soon.
The scientists have been able to test how quickly the solution works by genetically modifying the resistant bugs in a lab to make them glow.
They give out light, but they only give out light when they're actively living. When they start being killed, the light goes out.
We really do need to take it into a hospital environment, into a hospital trust, and see if it works. And we can only do that really by clinical trials. And actually getting that cooperation is difficult.
Just next door, microbiologists from hospitals right across the UK are being trained on how to detect resistant bacteria. This course has been modified 32 times over the past 20 years because the bugs are constantly changing. At the University of Bath, scientists have discovered that multiple strains of MRSA are now resistant to an antibiotic used as a last resort, and it could take years to develop new drugs.
I don't think just concentrating on antibiotic research is going to give us short to medium term results. I think we have to look into a number of different ways of tackling this problem, and research into new technologies would be part of that.
The Department of Health told us £3 million is being spent on developing new technologies, and that the medicines watchdog has been asked to set up a fast-track process to assess potential solutions. The government also says that in the next few weeks it will be announcing new initiatives to try and stop the spread of superbugs. Susanna Streeter, BBC News.
Well, joining us from Bristol now is Chris Perry from the Infection Control Nurses Association. We still don't seem to be able to tackle MRSA properly. Are you worried?
I don't think there's cause for people to be overly concerned about this. In every hospital in the country, we have policies, procedures and practices in place to reduce the risk of infection. Clearly, though, we have to address this problem. We cannot be complacent about bacteria that are resistant to antibiotics, and we must do all that we can to prevent the spread of MRSA and other bacteria in general.
How excited are you about some of the new technologies we've just been hearing about? They want to get into hospitals and start testing it.
Yes, I'm very pleased that people are looking at technologies to help us in our battle against these infections. However, I would echo what's been said in the report about the difficulties that we experience in putting into place some of the clinical trials that are needed. It is important that we assess these technologies in actual clinical practice to see how they apply and see if they do work in a patient environment.
And to go back a step, you often hear, well, maybe it's retired nurses who say this more than anything, that in olden days there used to be a different regime, hospitals used to be cleaner, and they think a return of that kind of regimen would help get rid of MRSA. Is that true?
That's very difficult to say. The evidence to say that general cleanliness of a hospital environment in a normal setting helps in the prevention of infection is lacking. However, there's a lot of evidence that when you're in outbreak situations, improving the cleanliness does help. And whilst cleanliness may not be the most important factor, it certainly does help staff to take pride in their work and to provide a high level of hygiene.
Chris, thanks. Don't touch anything in that newsroom, by the way. It's filthy.
Thank you.